Hi, my name is Kristen Williams, and a critical issue that we face in the Black community is childbirth. Black women are 3 times more likely to die while giving birth compared to a white woman, and I think part of that is due to a lack of cultural competency and cultural humility. I also think just a lack of representation also plays a role in that as well. There has been a stigma that Black people have a higher pain tolerance, and I think that with a lack of representation of color in our field, it makes it difficult for patients to truly relate and truly trust doctors. I also think that we have a lot of mistrust in our history, and that also is exemplified through our patient care connections with physicians. So I think that one way to fix that would just be to include more underrepresented minorities in medicine to allow for that increase in representation so patients can see that doctors can look like them. And I think that that just creates a whole space of comfort, and it helps the patient feel better advocated for. I also think that Black people in the community, there are not a lot of places that have accessible food resources. There are a lot of people that live in food deserts, urban cities, that you just don't have a lot of resources to be able to eat what you need, and that leads to comorbidities like diabetes, obesity, and I don't want to say that it's out of people's control, but it's definitely more difficult. There's also fruits and veggies that are found at places that are just more expensive. A lot of times healthy foods are more expensive, and it's not as convenient. It's easier to just grab a fast food meal, or it's easier to go somewhere quick if you don't have anything in your area. So how I plan to help that is to just open up food pantries and have food markets that are free fruits, free veggies. That way people in food deserts still have access to their fruits and veggies without having to pay for them. I think that is the biggest thing that will help decrease the health disparities in the US and allow for a better future with a lack of comorbidities within the Black community. We just don't have as many resources in general, and I want to help fix that by reaching out to different underserved communities and having free markets, hosting free markets, and having free food pantries, whether that's in connection with churches. That way we can ensure that Black people are getting the resources and the nutrients that they need. So those are my passions, and I will work to advocate for this community, and I will work to just be there as a voice and speak up for my people. Thank you so much.